We anesthetize the mouse with the animal anesthesia machine first. Generally, if there are no special tools, we will use a 50 milliliter centrifuge tube to make a mouse fixation device to perform tail vein injection in awake mice. We use anesthesia injection. When the mouse is anesthetized, the tail vein injection can be performed in a relatively quiet and stable environment. The mice can be injected without struggling. However, the blood flow of mice under anesthesia is slower, so the tail vein blood vessels are thinner. The liquid we use for injection is a saline solution with dye added, and the needle used is the needle used for insulin injection. We are ready to inject 100 microliters. There may be leakage during the injection process. We first draw 200 microliters of liquid. We are now waiting for the mice to be anesthetized. Let's first look at the mice. This mice is black. Its tail is also covered with black hair. The tail vein is hard to find. From the side you can see that there is a lateral tail vein. There are 2 tail veins on both sides. There is a vein on the upper and lower part of the tail. Because of the black hair, we can't see it clearly, so we choose the tail vein on the side. The injection point is generally selected at the back third of the entire tail. The blood vessels too close to the tip are too thin. If it is too far forward, the chance of trial and error will be reduced. If you choose this position for the first injection, the second injection can be moved upwards. In order to make the vein more visible, we can clamp the 2 sides of the injection point with our hands to slow down the blood flow. You can also use a rubber band to fix the 2 sides. Wait a minute. After being pinched with fingers for a while, the tail vein of the mice will become more obvious. Rub it with the finger, or use a cotton swab dipped in medical alcohol to stimulate the blood vessels to dilate. Look at this part. The pigment of the mice's hair is not so obvious in this part. We can try to inject it in this part. In areas with lighter pigmentation, blood vessels are more visible. The needle can be inserted diagonally, like this. There will be no feeling of blockage. If the needle hits the blood vessel, it goes in very smoothly. The fluid is also pushed in very smoothly. We do not finish the injection this time. These liquids are leaking out. The injections gathered under its skin also show that they did not penetrate. Let's move forward and try again. The bevel of the needle tip is upward, and it is inserted into the skin along the way. Aha, we didn't go in again. Let's try again. Not so well. It didn't work. This time, more liquid was pushed in. We wiped it with a tissue and tried again on the other side. Here, I just have demonstrated tail vein injection in mice.